Have you ever needed immediate relief from aches or pains, or perhaps need to have a quick recovery in order to attend an appointment of some sort? Well, if that's the case, you might be familiar with over-the-counter pain medication. Over-the-counter or OTC pain medications can be bought with a prescription and are intended to reduce fever and temporarily relieve minor aches and pains. OTC medications allow consumers to easily and cheaply treat several ailments as well as relieve numerous irksome symptoms without having to visit a doctor. The two main types of over-the-counter pain medications are acetaminophen and non-steroidal anti-inflammatory drugs or NSAIDs. They work in different ways and have different risks and benefits for each person to consider. Before we continue, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now, let's discuss over-the-counter pain medications. Acetaminophen is the most widely used active pharmaceutical component in the United States and is included in more than 500 over-the-counter drugs and prescription drugs, including numerous cough, cold, and allergy treatments, as well as painkillers, fever reducers, and sleep aids. More than 900 OTC and prescription drugs include NSAIDs, which are also quite prevalent. Aspirin, ibuprofen, naproxen sodium are the most popular OTC NSAIDs. Even some over-the-counter painkillers mix NSAIDs and acetaminophen. Choosing the best prescription for you or a loved one might seem complicated with so many alternatives available. You need to know the hazards associated with a medicine as well as which one will treat your pain the best. When taken as prescribed, OTC painkillers are efficient and typically secure. However, just because they are available over the counter doesn't imply that they are safe to use. They should never be used carelessly since they have the potential to be fatal if not used appropriately. Make sure to tell your healthcare provider about all of your OTC drugs. The majority of OTC drugs have the drug facts label, which contains the crucial detail of how you need to take them properly. Be sure to read the whole label before taking or administering any painkillers. You may learn about the primary components that make the drug function as well as its intended uses in the active ingredients purpose section. Always read the label's warning section as well. It explains when not to take the medicine, when medical advice should be sought out before using it, about potential interactions or adverse effects, and about when to discontinue taking the prescription. When used as recommended, acetaminophen is secure. Overdosing, however, is when you take more than is advised. If you take more than the recommended 4,000 milligrams in a 24-hour period, use it concurrently with other acetaminophen-containing medications, or consume 3 or more alcoholic beverages per day while taking the prescription, all of this might lead to severe liver damage. Before using acetaminophen, check with your pharmacist or other healthcare providers if you take a blood thinner like warfarin or have liver problems. People who use NSAIDs should be careful to read and follow the instructions and to take into account any personal risk factors. NSAIDs may induce significant gastrointestinal bleeding that presents no outward signs. You run a higher risk if you're over 60, have a history of stomach ulcers or bleeding issues, take blood thinners or steroids, take the medication with other NSAID containing OTC or prescription drugs, drink 3 or more alcoholic beverages per day, or take more of it than is recommended. Before using an NSAID, you should also consult a doctor if you have ever had issues with painkillers, have a history of stomach issues, have high blood pressure, heart disease, liver disease, renal illness, asthma, or taking a diuretic. Additionally, you shouldn't take NSAIDs before or after having heart surgery. Except for aspirin, all NSAIDs have been cautioned by the FDA to raise your risk of heart attack and stroke, both of which can be fatal. According to the FDA guidance, these several adverse effects can manifest as early as the first few weeks of usage, and the risk increases with time and dose. Everyone who uses an NSAID might be in danger, but those who already have cardiovascular risk factors are most at risk and should seek medical advice before using an NSAID. Ibuprofen can counteract the preventive effects of low-dose aspirin, which you should know. If you use it to prevent heart attacks and stroke, be careful to read the drug facts label for any special recommendations if you're expecting, nursing, or planning to give painkillers to a child. Always use a standard measurement tool such as dosage cup when administering drugs to children, and keep all medications up and away out of their reach. You are instructed on how much, when, and how to take in the directions section. Unless otherwise instructed by a healthcare provider, you should never take more medication than the label suggests. Make sure to take medicine safely. Once you've determined that it's acceptable for you or a loved one, take it for the shortest amount of time feasible, no more than the recommended daily dose, and only as much as you need each day. Never take OTC painkillers for more than 10 days without your doctor's approval. If a medicine isn't providing adequate relief, it may be an indication that you need to speak with a healthcare provider about addressing the source of pain as opposed to merely the uncomfortable symptoms. You should also think about whether there are any non-drug treatments that can effectively reduce your discomfort. Even if you still have a fever or pain, do not take more medication than is prescribed in a single dosage or per day. Also, don't take a second dosage before it's time. Avoid using more than one NSAID or acetaminophen containing medicine at once. Your prescription drugs may also include these substances, so do not forget this rule. If your pain worsens or lasts longer than several days, if you have new symptoms, or if there is redness or swelling where the pain is, you should stop taking the drug and contact your doctor immediately. Even if an individual seems okay, contact your local poison control center. If you or someone you care about takes more medicine than is advised, serious effects can happen without manifesting any outward signs. Make sure that you are using over-the-counter drugs safely if you're one of the tens of millions of people who turn to them for pain relief. That concludes our short guide to over-the-counter pain medications. Be reminded that this video is primarily for information only, and we do not claim to provide medical advice tailor-suited to your needs. Be reminded to consult with a medical professional and see personalized health that will fit you. I know that taking OTC drugs can be cheap, but be reminded that there is some warning signs and labels that you need to be aware of. Additionally, please leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later, and thank you for watching.